my name's Chris Thorne. I'm the Aboriginal Community Support Worker for the Coolangatta Ballot Project here in Central Hume. One of my jobs is to work with the hospitals and health services to help them make their service more accessible for the Aboriginal Torres Strait Islander community. So one of the things we did in the early days was to do a walkthrough. So I remember at Northeast Health I got the CEO and some of the executive crew to meet me out on the footpath. And the first question is why? Why can't we just meet in the boardroom? So anyway, the day come along and we're all standing out the front of the hospital on the footpath, and I said to the crew, turn around and have a look at the hospital and see this amazing service that you've got here. But I said, now have a look at it through our eyes as the Aboriginal community. What do we see looking at the front of your hospital that makes it a safe place for the Aboriginal Torres Strait Islander community to come to? So, as you know, the trauma we have and carry with us is a huge part of the way we live now. And to stand here at the front of the hospital thinking of all the stories we've heard growing up, all the negative stuff about our kids being taken away and aunties going in there and uncles and never coming out. So you can understand our anxiety is pretty strong when we're standing out here. So for us to feel safe to come into this service, we have to do something about it. And why I asked the CEO and the exec team to meet out here on the footpath is to get an understanding that they can see exactly what I can see. So from there we ventured into the hospital and we done a walk around the whole complex. Massive day it was, but it was a good day because a lot of positive stuff came out of it. Now if we fast forward that for a number of years, and not just recently, I was asked to do it again. So we met out on the footpath again. And it was amazing for everybody to see the change that Northeast Health had done. And I mean, the change was like that we stood in the same spot, and without even moving, we could see the Aboriginal Torres Strait Islander flags flying. We could see the acknowledgement of country on the front door. All these things squash and help lower our anxiety, and we haven't even left the footpath. A major, major thing. So we left the footpath and we walked through the front door, and it was absolutely amazing to see the beautiful Aboriginal art that was hanging on the walls. And it's not just that tokenistic one painting in the foyer and we've ticked the box. It doesn't matter where you walk around the hospital, there's opportunity to see a lot of beautiful Aboriginal art. That anxiety is even lowered again by able to sit in the waiting room, sit waiting for our appointment, wherever it might be in the hospital, and have the opportunity to pick up the Courier Mail, which is Aboriginal newspaper, or to sit and look at the paintings that are on the wall and think, oh, I might know that artist, they could be family. So all this positive stuff that Northeast Health has done, and in such a short period of time, has been unbelievable for our community. And we talk about it. We talk about all these amazing things that Northeast Health have changed and implemented for the Aboriginal Torres Strait Islander community in Wangaratta. Yes, I've had the honour to do a lot of cultural competency work at Northeast Health, and I think one of the big impacts for me is when I get to talk to the second-year medical students that come to Wang, because they're our future doctors. So it's really powerful for me to be able to share some knowledge and have them have an understanding about that intergenerational trauma caused from colonisation, which our whole community suffer from. So there's been a lot of things that I've been able to be part of at Northeast Health, and I continue to be that now that we've got Annie working there in HR as well as the
Aboriginal Health Liaison Officer.
Annie and I do a lot of work together now and discuss things and So I'll pass it over to her. She can introduce herself and her title and talk a bit about the things we've been doing since she's come on board.
Thanks, Uncle Chris. Yeah, so I'm the Aboriginal Health Liaison Officer. I've been there just over a year now. And what my job is mainly to provide support for patients and families that come through Northeast Health. I'm there to pretty much provide any sort of support that a patient and a family might need whilst they're in hospital and then after discharge. It's more about linking people up to services and support programs after they leave us to help prevent revisits to the hospital, I guess. We also have been doing a lot of things in the Aboriginal health space at the hospital, doing a lot of training sessions for doctors and nursing staff on Aboriginal health and what the differences are and the information that's out there for staff. We've also started a reconciliation action group, which is a group of Aboriginal and non-Aboriginal staff at the hospital, and we're developing our reconciliation action plan. We're almost at final draft now, which is a big thing for the hospital. We're actually the first hospital in the Northeast region to start their reconciliation action plan. We've just received funding from the Department of Human Services for a cadetship program for an Aboriginal nurse or midwife to come and work with us on a placement, which is incredible. We have a number of other different sort of programs that we run during NAIDOC week and Reconciliation week. So yeah, lots been happening in this space in the last few years, and we've been really fortunate that the CEO and the executive staff at the hospital are significantly supportive of what we do and how we want to work with the Aboriginal and Torres Strait Islander community. We've also become sponsors of the Proud and Deadly Awards, Uncle Chris, which is, you can say a little bit more about that. You've been involved since it started.
Yeah, the Proud and Deadly Awards started, I think, maybe 5 years ago now, and it's a program that recognises all the Aboriginal Torres Strait Islander kids at school that are at school, and it's an award to promote their health and well-being, as well as everybody gets an award, and it might be for their community work, it might be their sporting achievements or their academic achievements, and it's a really positive event, and it's started in Wangaratta. It's gets bigger every year. I think there was over 120 students last year who were presented with an award, and we have local elders sit up on the stage to present the awards for the young people when they're being called out. And it's had such an impact that Benella's taken on their own Proud and Deadly Awards, and I think this year will be their third year of starting it. So they're sort of piggybacking on the great work Wang's done. Wang's got all the problems ironed out now, and Wang High School are really good supporters. We use their hall, and yeah, it's a really positive event, and to see all the mums and dads and the brothers and sisters in the audience, how proud they are when their child's name's called out. I'm very lucky to be one of the elders that sit on the stage, so I see a lot of stuff from up there that I wouldn't see if I was sitting in the crowd. And to see them young people, when their name gets called, the smile on their face is just overwhelming. And to see mum and dad and nan and pop and auntie and uncle, whoever else is there to support their kids, it's a really great event. And yeah, very proud to be part of it.
And it's also another way too for our community to be proud of being Aboriginal Torres Strait Islander, to be recognised that it is okay to identify as being Aboriginal and Torres Strait Islander in our community. And sometimes we do have a lot of challenges with that. So yeah, Northeast Health have been a part of that for just recently this last year, but we'll continue to support that for the years to come. But yeah, thank you so much for taking the time to listen to us today. It was really just a way to let you know what we do and how we do it. So if you do work with any patients on the wards or know any community members that feel like they need some support, you can always get in contact with Uncle Chris or I. You'll see our details on the screen there soon. So yeah, thank you very much for this afternoon, and take it easy.